This is a massage protocol for adhesive shoulder capsulitis, otherwise known as frozen shoulder syndrome. Frozen shoulder syndrome is caused by an excess of scar tissue in the glenohumeral joint, which can lead to a decreased range of motion, pain, and stiffness. It is caused by a prolonged time of immobilization, such as a sling or bed rest. This massage protocol will help dislodge and remove some of the excess scar tissue. It will increase range of motion and decrease pain and stiffness. Alright, so we start by doing some compressions on the pectoralis major, trying to work that towards the shoulder, trying to make a little bit of space here. Now we're going to the shoulder, and we're actually going to jostle it, moving up and down, trying to break up that scar tissue, actually getting our hands in between the shoulder and the body, really trying to get in there. Right now we are doing eccentric active release of the biceps brachii. Biceps brachii crosses the shoulder and elbow joint. Here we're just trying to release a little bit of tension and allow the muscle to relax, which will help us later on. So right here I'm going to take his arm and place it across his body and do a deltoid stretch. The deltoid is one of the major movers of the shoulder. Being able to stress out its fibers will allow to reduce some scar tissue and increase mobility. So here we are taking him through his range of motion passively. With frozen shoulder syndrome, the mind will actually create limiters on how far the shoulder can move. Often it's not the full range of motion, and you're actually able to move the shoulder farther than the person is themselves without causing injury. Again, this helps break up scar tissue and retrain the mind on its rotation. Here we are working the subscapularis muscle. Subscapularis is located underneath the scapula, so we're actually able to lift up the muscle and work underneath the scapula. The scapula is held down by the latissimus dorsi, teres major and minor, supraspinatus, and the rhomboids. Here we are working the teres major minor in an attempt to release the scapula a little bit, so we're able to get into the supraspinatus, which is located directly underneath the scapula. Now we're making sure that the scapula returns to its original position, as it has a tendency to tilt from side to side.